of the Department of Family Promotion and Course of Life of PAHO. Today, we're going to discuss a very important topic, a topic that is of importance to all of us, and especially in today's situation. We are information and data. So we're going to talk with the people who work with the Perinatal Information System. We're going to listen to the personal experiences and then CLAP's experience. But first, let's listen to Dr. Andrés de Francisco, who will open our meeting. So, welcome you all. We are going to enjoy an hour and a half of a meeting that we hope will be very fruitful for everybody. Andres, go ahead, please. Yes, thank you, Suzanne. Welcome you all to this seminar. This is going to be a truly interesting topic because we're going to share many of the experiences that we've had. I'm Andrés de Francisco, the director of the Department Family Health Promotion and Course of Life at the Pan American Health Organization, and I'm very happy to give you this welcome. Let me share my screen. And I beg you to please tell me whether you can see it. Suzanne? Not yet.
Tienes que darle start, creo.
I think that you have to click on start. We'd practiced this already and it had worked.
Un momentico, disculpen.
If it doesn't work, Andres, never mind, because we have it here and we can upload it too. So let me know and we can do it. I don't know whether you made any changes. None. Yes, but if you can load it.
Ahora. Tú puedes arrancar si quieres.
Perfecto. Bueno, muchísimas gracias entonces, como decía,
So thank you, as I was telling you, because of your participation, for joining us today for this session. First of all, I wanted to tell you a bit about the work that is currently underway with SIP, with the countries of the region, with CLAP, and especially to focus this topic and to approach it within the global strategy for the health of woman, the child, and the adolescent. That you know that in Geneva, the WHO approved it in 2016. This initiative is a global initiative, and it is quite relevant. It's a union. It's putting all the different branches of the working areas together, everything that has been done under the framework of the course of life, and especially in the health continuum of the woman, health of newborns, and health of the child, and health of adolescents. This initiative basically brings all these elements together. So it somehow gives us a good structure so we can work with these topics that are very closely linked with each other. So thank you, Suzanne. And basically what we are trying to do with this plan of action is to apply these elements that come from the global level, to apply them, to implement them, while adapting them to the needs in the region. And basically, this is to protect all our achievements so far and to solve the gaps that still exist, so as to ensure health and promote the well-being of women, newborns, children, and adolescents in the region. In that regard, what we are doing is using some of the tools that already exist in the region, and CLAP has been working for about 40 years in a tool that has helped apply this and implement any actions required to improve the health of this group. So the vision, the mission of CLAP is to produce, to generate and to disseminate knowledge with a multidisciplinary perspective, facilitating the development of policies, technology, building solutions in the perinatal health, women's health and sexual health and reproductive health, together with the governments of Latin America and the Caribbean. And it is there that we have an overlap between what CLAP does and the implementation of the plan of action for the women, children, and adolescents from 2018 to 2030 in our region. So bringing the two joint elements, what we see is the plan of action is reinforced in terms of its implementation, dissemination, analysis, and creation of public policy. As we join the implementation of the plan of action for the health of women, children, and adolescents. So the plan of action promotes strategic plans to implement the limited availability of data, which is one of the key things that was debated from the beginning, both in the global strategy as in the local plan of action, the regional. We don't have enough information, but especially we don't have disaggregated data in the groups that are more delayed in a population and that would have more opportunities for improvement if we focus on them. Unfortunately, the data is not available, so SIP comes as a vehicle that is available not only since 1983, but it's been innovating technologically so as to contribute to the plan in two areas. First of all, to address the approaches for transformation in health. That is one of the 4 strategic guidelines lines in the plan of action, where we see how to improve, how to reduce inequities in the use and access to health care, both in the primary or in reference or in referral centers. And we look at it also from the perspective of the course of life, but especially looking at other data sets that are outside the healthcare sphere. That is another strategic action of the plan of action, where we see that health, especially for women, children, and adolescents, is not just dependent on the health sector, but it has many multi-sectorial elements that are absolutely essential for the improvement of health of these subgroups in the population. So here, the link with CLAP and especially the link with SIP, the SIPPlus, the new SIP with innovations, is making it possible for us not only to collect and analyze data, but also to guide very specific actions at a country level and so as to improve the work that we are conducting in the region. So having said this, and thinking of this innovation of the SIP accompanying with a plan of action, this helps us structure some of the values and the principles of the plan of action as configured in 2016 and were approved by the member states in the region in 2018. The first thing is equity in health. We can't have it if we don't have the information of the vulnerable groups that don't have access to health, and if we don't know the reasons why they don't have that access specifically. The community participation is absolutely essential for the interventions in the communities. As we said, a multilateral, we need evidence. We need to have the data and analyze it, to implement it, and to frequently we have the elements of inequities related with the intercultural issues, including the issue of gender equality and equity, and also elements of violence that are related with this topic. And so we need to see the course of life, and we need to see the data that we need. We are not a research organization, but we are always paying close attention to detect the gaps that will help us solve any inequities. And to that end, we use innovation and research. And finally, accountability, because that is what we plan to do, so that in 2022, where we have the next draft, the next report, in 26, the second and the final report in 2030. So what we have here is that CLAP is not just gathering information in the countries, but also creating the capacities in the countries to see to the sustainability of SIP and SIPPlus. So it's using the data collected and is learning from the lessons learned using SIP. And in 38 something years that CLAP has worked, it managed to establish that one of the most important elements in terms of obtention and analysis of data, or to analyze and identify any gaps of anything required. So, as I said, this is very closely related with capacity building in the countries, not just in teaching, but also in how to use the tools that are valid and that are very important, clearly, for the work that is underway at the ministries and at the healthcare departments in the public sector. And in that regard, the sustainability is having a mass of human resources that not only uses this, but also does it for the design of the public policies, but also to improve the healthcare services. So the innovation that has led us to improve the IT system has led us to develop some of the things that we're going to discuss today. Topics we are going to hear how this was implemented in 3 countries: in Panama, with the incorporation of SIPPlus at the Ministry of Health. Could you please go to the last one? Yes, there. So in Paraguay, see how SIPPlus was adapted to their IT system, and some interesting things of the work of the groups in the region. So we're going to look at those experiences directly. And finally, to discuss the regional technical areas, looking at the perinatal area, which are the elements that are usually left behind. Some of them are the elements of congenital malformations, how they can be prevented, what can be done, and an inclusive system, as we see here, may help because it has the perinatal record and the medical record of the woman, and so we can see all the data available as with time. And in maternal mortality, the SIP has had a great influence, and so has SIPPlus, to look at the areas where we need to intervene and we need to work. And in this case, we have a new chapter, a new page that on COVID-19. It's very important for maternal mortality, and it was implemented in this region before others. And CLAP with SIP has a very good advantage showing what's happening in the region and how we can mitigate the consequences of this pandemic. And finally, in sexual and reproductive health, in terms of the work that is done and that we need to continue to do with contraception specifically or majorly for adolescents, but also elements, as I was mentioning before, of gender violence and violence against women. So these are regional technical areas. There will be many more, but we are going to listen from the countries and then from the technical experts of CLAP and SIP, and see how we are using this information, what we are doing, and what are the abilities that we have to work with this in the future, because we are working with the health plan of action for the health of women, children, and adolescents to 2030. We need to continue to make progress. And among the regions of the WHO, the only region that has advanced in the implementation of the plan of action of the global strategy is this region. So we continue to innovate, we continue to move forward, we continue to lead. So welcome you all, and I hope that you participate and enjoy this seminar. Thank you, Suzanne. I give you back. Well, thank you, Andres. I think it's been very interesting to hear your words. The most interesting thing is still to come, because CLAP works in a technical collaboration with the countries, but it is in the countries that we do our job. Each idea that we have and each idea that we need the countries to implement. And some countries have worked for many years, and in others, I remember the first time that we showed the Minister of Trinidad and Tobago what SIP was, and right away the country showed its capability to work with it. So today we're going to listen from 3 countries. Panama, Dr. Geneva Gonzalez Tejera will from the Ministry of Health, and Domingo Stanciola of the Caja de Seguro Social. They're going to share a presentation, and after that, we are going to listen from Paraguay, Dr. Cesario Saldivar, who is going to speak about from the ministry, and he's going to tell us of an exemplary experience. And SIP enables all the countries to use it, but in more vulnerable places and more special places, it makes it possible to have a very strong information. And finally, we're going to listen to Trinidad Tobago, our colleague Adesha Sirju Singh. So, Geneva, you have the floor. You'll be the first speaker. Please share your information. Thank you, Andres. Thank you, Geneva. I'm not going to introduce each other, but we're going to do it back to back. Geneva, then Domingo, and then Cesario. You go on one after the other. Thank you.
Geneva, no se escucha. Creo que tienes el micrófono apagado.
Geneva, we can't hear you. Maybe your mic is off. Please, could you turn your mic? Yes, yes. We have a technical problem sharing the screen. Good morning, everyone. We want to thank CLAP for their very kind invitation to share our experiences with the Perinatal Information System in our country. Can you see the screen well? You have to click on Configuración de Visualización on top in the middle. There.
O sea, en la pantalla alternativa.
In your alternative screen, there where it says configuración de visualización. There, yes. Perfect. All right. So very quickly, let me give you a summary of what Panama is. We have a territory that is about 76,000 kilometers.
Está dividida en 10 provincias, sin embargo, desde el punto de vista de salud pública,
The geographic distribution is here. We have 15 health regions. According to the survey in 2010-2020, at present, we're close to 4,314,768 inhabitants, of whom 2,072,000 are women and 2,055,000 males. If you observe, there's a relationship of men and women quite similar. In my country, 45% belong to groups in reproductive age. So our responsibility in the health ministry is large in sexual and reproductive health. So, in general terms, our country started using the Perinatal Information System and the card since 1990. Nearly 7 years after the Latin American Center devised this very effective tool, and Social Security included it in 1994. The Public Health Ministry, however, well, we have Social Security separate that provides many services and first level care hospitals. So we really have two arms at public level in health, the public health and the Social Security, and additionally, private clinics. In our case, in Panama, the perinatal clinical record was a bulwark of support, but it was implemented. Colón was the first province that started the use of this system in a pilot plan 2005. And in 1995, we have
atención integral de la mujer en el embarazo parto puerperio. Se incluye el sistema
comprehensive care of women's care during pregnancy and postpartum, including it. And since then, to date, of course, we've suffered many changes that improved the system. We had data entry in 2002. It's used in hospital, and it was carried to the national registry. And we also used the original format with registry units, and we requested to have it as the ID because it's used throughout in the country, and it's a rapid graphic representation of patients. In the 2008-13 period, we've been using our perinatal card at national level. We started, as elsewhere, to have filling problems. Sometimes we didn't have enough. Data gathering was also difficult in spite of the change of platform to SIP windows that did help, but data were gathered very late. Another thing we saw, particularly in 2012, is that our physicians training reached hospital and had to be retrained to fill this, and this delayed data obtention. So we had a meeting with the teaching staff. I was part of the faculty there at the time, and in the School of Medicine, at the time, we trained residents as gyneco-obstetricians and then as a postgraduate course. And it's mandatory right now for all schools of medicine in the country to provide training for the Perinatal Information System. We also gained a lot with the implementation of electronic systems. 2011 first with the clinical records. This is the support we used to pass from the previous platform to SIP web. Indeed, this could only occur with the full support of CLAP for training. And apart from having SIP web in the regions, and I'll tell you briefly how, we've been sharing documents to regulate these situations. For example, we have guides for creation of roles and uses in the Ministry of Health. And by 2019, after implementing the system in the internet, the first 7 regions at national level extended this methodology for training.
Por regiones, recordando que somos 15, en estos
In
momentos son
different
9
regions, we're 15 now. Now we have
Revisamos el hecho de
9
que ya el
trained
electrónico
because
vía
the
6
electronic system in our country
veamos ahí como hermanitos
already required computers, so we used the same computer. But I'll tell you something more later
y con el
in this regard. These supervisions were with the support of the Panama Obstetrics and Gynecology Society that became another partner to reproduce this document. However, until 2019-20, this was only being used in the Ministry of Health. In 2020, in spite of the pandemic, apart from preparing our own indicators sent to CLAP and maintaining training supervision in the regions in the West, in the North, and East, we also jumped to Chiriquí and Joclé and other more distant areas. And 4 more regions are waiting, but one is ready for training and waiting for the other 3. But the maximum achievement, in my view, was to enter into the SIP web platform with the Santo Tomas maternity, that's the #1 for deliveries in our country, and has been linked to a partnership with the CLAP. This was the start. Others added on to the process, and now we're waiting for another center with a lot of patients integrating the system with SIP. Maybe what is really relevant to maintain SIP is strengthening training and capacity building in the regions in spite of already had training. This just to remind you.
Geneva, no te escuchamos.
Geneva, we can't hear you. Sorry, it was. Shall you continue speaking because the microphone is off?
Okay, creo que me lo cerraron. Bueno, finalmente, y esto para compartirle.
Finally, and just to share, our major opportunities were the electronic systems, our partnership, the Panama Obstetrics Society and the university and private universities, Latin American Perinatology Center, supporting training and with counseling 24/7 that has allowed us to continue. And we want this to spread at national level. Thank you.
Creo que el doctor Estanciola le toca hablar. Vamos a...
I think it's Dr. Estanzuela who should speak now.
Domingos, adelante, por favor.
Domingos, the floor is yours. Yes, we're ready. Just waiting to share the screen. Thank you.
Buen día a todos, un cálido saludo desde
Good morning, everybody. Warm greetings from Panama. Briefly, I wish to complement the information about the country with the social security work to implement SIPPlus. We've faced many challenges in this area. Many situations where those who have made progress have seen it, and those who haven't will meet. And what we'll now share is the responses we've had to our work. First, the procedure, the technical document, and 200 organizing SIPPlus in Social Security. And then we'll speak of the training platform and the interconnection. The document known as Procedure 200 in the Social Security Department is a tool that responded to many of the challenges we met on the way. Some collaborators didn't want to complete the information because they said they didn't have time. In some places, there was concern about the safety of or security of information. All these situations occurred, and we had this document 30 where there's a description and standardization of the mandatory quality of this platform and its legal framework, and the different steps to request access to the platform, the different roles that may be offered, and how the care will be provided to patients using this platform, and also what will be done in case there are failures in the system. This document is an important piece of training. It's been widely distributed and has been one of the basic tools to help us advance in the implementation of SIPPlus in Social Security. This, together with the training processes proper, we've used all the resources possible, in-person presentation, lectures, Zoom meetings, but what has really been useful is the development of a training platform online using Mural. This was developed with support from the Ministry of Health of Panama, Obstetrics and Gynecology Society, and PAHO, and CLAP. And it was extremely important because they provided technical support, but also facilitated the testing in CLAP in Uruguay. And this allowed us, and now I'm going to show you this training page. This is an e-learning page of the Social Security, and here we can enter the SIPPlus course. And here we have these different hands-off concepts, the legal framework, Procedure 200 as mentioned, and more particularly the use of this platform, the hands-on testing where you receive a clinical case to look through and include the data using this hands-on platform. And in the final assessment, we have an exam, and you receive the certificate that indicates that they completed the course.
Entonces, esta ha sido otra de las herramientas que nos permitió incluso durante la pandemia continuar los procesos de capacitación.
These tools allowed us to
Podría ponerlo en modo
training in the pandemic.
Sus slides no están avanzando.
Could you put them as a presentation because your slides are not moving any forward?
Ahora sí.
There?
Ahora sí, perfecto. Gracias.
Yes, now that's perfect. Thank you. So, another very important hallmark that Dr. Geneva already mentioned was interconnection. That is, as I mentioned, in a country there are two big systems. The Ministry of Health is the healthcare provider and it provides care to 60% of the population, and the Caja de Seguro Social, where we also share much of the country. We are present in over 10 regions, and they provide care to 40% of the people now of the population, but in some places the facilities of the Caja de Seguro Social offer the antenatal care, but childbirth care is given at the ministries of health, and in other regions it's the opposite. So in order to be able to exchange information between the two institutions virtually with SIPPlus, that was a whole issue that was about to conclude, and we already saw the legal arrangement, and it's the MINSA CSS SIPPlus of the Ministry of Health and the Security Fund. So because each agency has its own legal framework, and this has been a very good opportunity to exchange information and hence to improve the care of our female users. So that would be all so far. Thank you for your attention.
Muchas gracias.
Thank you. Thank you, Domingo. Now, Cesario, take the floor, please. Could you open your microphone, please? Yes, thank you.
Buen día para todos y todas.
Good morning, ladies and gentlemen. I'm Cesario Saldivar. I'm the Director of Sexual and Reproductive Health of the Ministry of Health of Paraguay. I'm under the General Directorate of Health Programs, and I'm very grateful for for your kind invitation to share the experience of Paraguay on SIPPlus. The implementation of SIPPlus, we have the regulatory framework is supported by ministerial resolutions from 2014, 17, and 18, and it's under the national health policy. I want to go back here and to show you the map of our country, because this has to do with what comes later on. We have an eastern and a western region. The western region is where we have the most vulnerable people. And so in the western part here, we have here you have the Paraguay River, and in this region, this is the Chaco, and we have the President Ayes, Boquerón, and Alto Paraguay. So on July the 13th, 2021, we got this reference note, correct filling of SIP and hospital discharge. We sent to each region a note for the correct filling. It is good to highlight that through the National Directorate of Health Strategic Department, we have different tools for the data and information. And one of them, of course, is the history of the offices, the hospital, the wards, etc., and the SIPPlus tool, of course. And we must acknowledge that we have weaknesses in our data, and we are working intensely to improve our data in terms of both quantity and quality. And specifically, we'd like to tell you of the experience of the region of Boquerón. Our country is divided into 18 health regions, and Boquerón is the 16th. As you saw in the map, this is it's well on top, the north of the Paraguayan Chaco. It's very arid and the population is very vulnerable, as I said. In 2018, they received the first visits and the training of the person in charge of SIPPlus with the technical cooperation of PAHO WHO. And in July 2019, they started entering the data in the regional hospital of Boquerón, and it continues to be done so far. And so the perinatal clinical records reach to the Boquerón and to this area that it's a health area that covers almost 92,000 square kilometers, but there are many problems. We have adverse situations in the territory. At present, we are trying to improve this through a project of the Ministry of Health and of well-being, through improving the quality of data that is based on delivering 25 computers and access to the internet in the emergency rooms, in the offices and in the administration part. Boquerón has 39 active services, 11 of which are private, and only one of them loads SIPPlus data, Hospital Indígena. However, thanks to the good position of the regional director, channels have been open to start implementing the perinatal medical record and loading SIPPlus in the 11 private services based with the support of the ministerial resolutions. Other services mentioned, the health care officers, the indigenous clinics, and the mother and child hospitals, and the regional Boquerón hospital is where they control the antenatal health and the deliveries, and from those places they refer the patients for higher complexity childbirths. We know that our perinatal clinical record is a source of very rich information for all, and that it nourishes different programs at the health level. The lessons learned in the process, SIPPlus gathers specific information for data analysis, concentrating similar information to other systems of forms, and with the continuous use and updated in real time, SIPPlus may conduct an analysis of many indicators, reducing the time for obtaining the data that will be for various registries, and it can be done with just one click. In addition, you can access the information to the private services for the timely analysis of the cases, an alliance that we have dreamt of for years. An explicit example of the benefits of a cooperation when delivering the computers at the Chaco, it receives what we had a storm, where the electrical power was unstable. So but still you can continue to work, and you can work and fill in the data despite the adversities that we mentioned. We need to enhance the monitoring of the people, the healthcare professionals that participated in August this year, where we had a course on SIPPlus and advanced, and this is essential for the data analysis and reports, something that was quite important on sexual and reproductive health in Boquerón, in the basic and advanced courses. The exercises including variable crossings. It was an online course. With the people of CLOP, they could implement that exercise. And for us at the Ministry of Health, and I think for them too, it was very good to see staff in very distant places filling in this exercise, and very well. So the idea is to train the managers in the analysis tools and basic statistics to improve the decision making with regard to maternal and child health. It's essential for all the health managers, all the directors of hospitals to see SIPPlus not as a burden, but as a tool that will be very useful for decision making and to be able to plan the future of the sanitary region, to promote the monitoring actions of the staff that participated in the training in March 2021 with the correct filling of the medical records and loading the data in SIPPlus. And this is essential for the database that needs to be ready by 2022. SIPPlus is at a data center of the Ministry of Health and Social Wellbeing, and it can be accessed through the internet. In the country, SIPPlus has 1,004 users enabled to load the system, and the current database has 46,728 medical records. The coverage in the country, there are 18 health regions with 151 districts and 438 facilities. We know that we still have many gaps, but we are very excited, walking for improvement. Well, thank you for your attention. Thank you, Cesario. That was an excellent presentation. Please, Ades, you have the floor.
Thank you very much. Good morning, bom dia, buenos dias. Some of the information that would have been presented already by the previous speakers, I will try not to go too much on it. I will, of course, try to go slowly, and I apologize to the Spanish-speaking audience. My slides are, of course, in English, so I will hopefully speak slow enough so that the interpreters may be able to understand. So I am Dr. Adesh, and I am the Director in the Women's Health at the Ministry of Health in Trinidad and Tobago, and we are really happy today to share with you our experience in the implementation of the Perinatal Information System in our country, which is in the West Indies in the Caribbean, in Trinidad and Tobago. It's titled A Digital Revolution. Next slide. So I will give a little background as to why SIP was implemented in our small twin island country. As you can see from this chart, which shows maternal mortality ratio, we have had some good times and some bad times, despite the economic input into health in Trinidad and Tobago. It has never been sustained in terms of maternal mortality ratio, which we all know is an important index of well-being of your country. In fact, we had failed to meet our Millennium Goal targets. Next slide. So over the years, despite all of the resources that we put into our systems, things had not been sustained. In 2011, the government of the day formed a committee. I was privileged to be on that committee. And one of the recommendations of this committee is that we recommended to the government that we should, amongst other things, have a standardized system of perinatal record. This did not exist. We were actually using the forms that you see here, which were based from the 1960s. We are not pleased of that. Next slide. This slide is a little busy, and don't get overwhelmed. This is just to say there were some very notable dates. So Trinidad and Tobago is very new to the SIP in the sense that we started our road just in 2015, but we have come a very long way through the help of the team from the CLAP and of course the PAHO, who have guided us all the way. So in 2015, again, I was privileged to attend a very special meeting where for the first time I met the team from the CLAP, and they introduced me to the program and what it meant. And of course, having been on that committee I spoke about, I wholeheartedly endorsed it, and I informed the government of the day that this is what we needed. And just 2 or 3 weeks later, we had our very first meeting in Trinidad and Tobago, where everyone started to come on board. We did a collaborative process. Trinidad and Tobago is a little unique. It was different from Latin America. We had to make lots of changes and adaptations. But again, it was a very collaborative process. And 2016, lots of meetings. 2017, piloting started. And by 2018, the government of the day was sold that the pilot was working well, and we made a mandate. It was a government decree that everyone had to use the hard version, the printed version of the Perinatal Information System. But we didn't want to stop there. We continued to build on those gains, and eventually we reached to the point where we built the ICT backbone and installed servers and interconnectivity. Next slide. So this is actually a small map of Trinidad and Tobago. It's divided into small regions. We have approximately 1.4 million persons. And you'd be surprised we actually have such a small number of babies being born. It's currently around 16,000 live births, which certainly doesn't compare to some of the work that you all are doing. So I appreciate that what we may have done may have been a little faster to achieve. However, we still do have remote regions and other things that we had to fix. It's always been a work in progress. Some of the distant areas continue to go back to use those 1960s forms, and we continue to work with them. But by and large, the majority of persons in the public healthcare system use the new forms. And we have piloted the electronic versions, and that is going quite well with the SIPPlus in some of the sites. Next slide. As I said before, we would not have reached where we are without commitment at the very highest level. So before the Directorate of Women's Health came into being, we had the commitment from the Honorable Minister of Health. And there was really, as I said before, guided all along the way and continued to be done so by the CLAP and the PAHO. Next slide. We built the infrastructure. There was significant training. We had to get equipment. We had to build the IT environment, but we could not have done it because the number 4 on the slide is the most important part. There must be change management. People needed to do new things, and that was the most difficult part. That's what we're working on right now. Next slide. We're investing in the future. We can't change SIP without getting our trainees involved. So we are inculcating training into what's called pre-service training for the younger persons, not just in medicine, but also in our nursing profession, in the midwifery school training, as well as medical records and ICT training. We have to invest in them to take this into the future. Next slide. So coincidentally, this was not planned. Just yesterday, we had one of our larger resensitization meetings on the SIP, on SIPPlus, and we had lots of presentations from all of the different regions where we were able to learn from persons who were excelling in this. We had to create some national leadership on this program. Next slide. So coming back to this slide again, this is an extension of the slide that you saw earlier. So this is the same slide, and this is the second part of the slide. If you look to the right of the slide, this is when SIP was introduced into Trinidad and Tobago, along with a number of other measures, of course, to help reduce maternal mortality. I'm pleased to say that we have had a sustained reduction. We have actually been under 30 since the last 4 consecutive years with respect to maternal mortality ratio, that's per 100,000 live births. However, just like all of the other countries, and I know it wasn't said here today, maternal mortality has actually almost doubled in this past few months as a result of COVID deaths. We'll speak more about that at another forum. Next slide. So at present, Trinidad and Tobago is using a mixture of the physical SIP records, and some persons are using the SIPPlus. That's where we are today. But our future is bright. SIP persons have bought into SIP. We are going to be expanding SIP into all our public healthcare facilities. Approximately 90% of our clients deliver in public healthcare facilities. So it's a very good opportunity to capture the majority whilst we start working on the 10% in the so-called private sector. We are also looking at expanding SIP for other projects we are working on diabetes in pregnancy, intimate partner violence and sexual violence, breastfeeding. We are working on pre-pregnancy information as well as neonatology information. We're looking at the life course and building on this excellent platform of perinatology provided by the SIP. Next slide. So just to give an example, this is Trinidad and Tobago's version. We actually have included just at the top, you can see a new barcode system we are working on to help generate an identifier, which can be used elsewhere. And we have added information to do with our diabetes in pregnancy program, which is a very important program, as Trinidad and Tobago has a very high incidence of gestational diabetes and chronic diabetes. Next slide. This slide looks a little busy, but this is related to the diabetes and pregnancy project. We are using the SIP as the clinical information system, which is on number 1, numero uno. And from number 2, 3, 4 represents, for example, number 2 is a point of care device. You go to your local level, get your blood test, it uploads to the system, and through interconnectivity, through a system that allows computers to speak with each other, all of these results, be it from the point of care, from the actual laboratory, or even the patient's handheld blood glucose meter, will be seamlessly uploaded. They'll be all talking with each other and populating the information in our SIP program. So you can access this data, you can generate statistics, alerts, reports, and of course, have informed decisions for policy. Next slide. This is another part of the building on SIP again that we're doing in Trinidad and Tobago. Again, this has to do with gender-based violence and intimate partner violence. So the persons who are responsible for doing the medical examinations and interactions with persons who experience intimate partner violence and sexual violence will document these forms, and they will also go into the SIP system. Next slide. Breastfeeding. We have to incorporate our breastfeeding information if we wish to achieve baby-friendly hospital initiatives. We have put all of the information. So far, we have piloted this in hard copy, and that's the forms you see in the middle. They capture all of the information in the 10 steps of breastfeeding. And we take this information, once the system is working well, we will be working with CLAB to hopefully incorporate this interpatient healthcare records in the SIP system. Next slide. I just want to say another thank you to everyone, and a special, I would like to dedicate this to our colleague, our dear departed Gerardo. Thank you very much. Thank you for your attention.
Muchas gracias, Aves.
Thank you
Muy bonito
so much.
que traigas el nombre de
It's
Gerardo.
very nice to hear about Gerardo. I was going to mention him at the end, but it has moved. But right now, the team will have the floor So I hand the floor to CAP colleagues, and we're used
Chireto tiene
to hand the floor to each other. They know who goes first, so Luis maybe first. So thank you all, the people that made the country presentations, our colleague Geneva, Cesario, Adesh, and now we'll have Luis, Pablo, and Marcelo. The floor is yours.
Bueno, buenos días a todos.
Good morning, everybody. Can you hear me well? Good. You just have to turn on the camera.
Ahí.
Can you see me now? Good.
Bueno, antes que nada quiero agradecer a los colegas.
First, I want to thank colleagues who spoke before me. It's a true pleasure to see the progress made in the installment and use of software. We know that in the region there are other countries, most using the software. And the truth is that it's a joy to see the great progress as heard. I will briefly show you some new things we have, because we make the most of this sort of meeting to show this progress, because there are many people connected, so it's a good occasion. SIP, as we always say, can be subdivided into 4 parts related to the clinical records, workup, and then what's new and integration. And we'll hear about the future of SIP by Marcelo. As for the clinical records, the prenatal clinical record is known by all the people connected today, and SIP has, and I'll show it here, other modules that are sometimes less known, but also extremely important. And in the next presentations, you'll hear about them. The neonatal clinical record, women in situation of abortion, the community module, multiple organ failure, congenital abnormalities, Zika, dengue, chikungunya, and notes. It's all integrated as a major record where the information may cross-talk. However, we continue working and adding new forms. The idea of my presentation is to share with you, together with the other CAP colleagues in this brief introduction, what's new. We added the maternal COVID module, the neonatal COVID module, the maternal mortality certificates due to death by COVID, and 2 large modules quite recently, and that's contraception and violence, as mentioned by Adesh. So, this is then our experience with the new modules in SIP. But as we always say during meetings, and I'll highlight it, the countries have also consulted us and requested small changes, and that is the case of Argentina, Bolivia, Colombia, Nicaragua, Uruguay, Bahamas, Grenada, St. Kitts and Nevis, St. Lucia, and Trinidad and Tobago that have included small changes to the perinatal clinical record, and in some cases to some of these other modules we've been discussing. So in this brief presentation, the idea was to show you what's new in the current SIP version, and here then you can see the COVID forms, contraception, and violence. We also have some changes and progress in the modules related with tests, the analysis of information. In this presentation, we can't share everything we have, but just the basics. Here, the basic statistics report model we have been using since the initial SIP versions, and we haven't removed it because it's in all trainings. And we added modules for communicable diseases, Robson indicators, the 10 categories. We always say this is a good example of extremely complex indicators. And here, with one click, you have them. We recently added the graphic representation and or the course of these Robson indicators. We also added indicators for perinatal outcomes that the colleagues that will speak next will further elaborate on. Then women in situation of abortion indicators and for the near miss. As you're aware, there is a large amount of possibilities of analysis. Some are constructive, some evolutive. For everything we have in the clinical records, in all the records, we may obtain reports for each of these variables. And as we always say, the same occurred in the clinical records and in the reports. But we had countries that requested we have reports with one click, a single click report, including the indicators required at ministerial level. This was the case of Argentina, Bahamas, Dominican Republic, Honduras, Nicaragua, Trinidad and Tobago, and Uruguay, where the reports were tailored to ministry requirements, including sometimes even hundreds of indicators that can be obtained with a single click. So the idea was to show you what's new in SIP reporting, perinatal outcomes, indicators of near miss, and some descriptive additional analysis very recently, and I don't want to leave it aside. We've been done to work in an area I really like. We work with others in small automatic learning models that in the short term will be included in the SIP analysis in another analytical development model. So this then is what we have in this second leg of SIP for reporting and indicators. Last, I won't enter into detail in my presentation.
Pero en función de
This is the last item I will
presentaciones
mention.
anteriores decidí mostrarlo un poco para reforzar justamente eso, que es el por qué nosotros hablamos del SIPPlus, por qué lo proponemos.
She has very bad connection. As you know, the clinical records are loaded from a smartphone, a computer, a notebook, whatever. They remain in the different devices.
¿Con qué finalidad? Con la finalidad de que esa información
quede
centralizada en una base de datos.
Information remain centralized in a SIPPlus database. Where will it be centralized? Well, in most countries, it's centralized in the ministry. However, I know that today there are IT colleagues connected today, so I wanted to share this with them. Some countries have chosen to have decentralized servers, be it in the case of Nicaragua, where they have in Cesario, and Argentina, where they are installing it at provincial level, and they've had good outcomes. So I wanted to mention it because there are other colleagues making questions, and I wanted to share it with them. Last, what is the idea of having this centralized SIPPlus? As mentioned before, the idea is to relate the SIPPlus data with a different ministerial system, be it the live birth certificate, the death certificate, vaccines, ID, everything related with life course. And right now, in the last two forms, we've added violence and contraception. All the SIPPlus machinery or ecosystem is under the umbrella of what we know as e-health or e-government. So, grossly speaking, this is a brief summary of what we've been seeing this last year.
Dejaría entonces ahora.
I would then hand the floor to Rubino to continue. We had some news that arose in the recent months where these people are also discussing this. Thank you.
Buenos días a todas y todos.
Good morning, everyone. I'm Marcelo Rubino. I'm also part of the SIP.
En este caso, una aplicación que hace mucho tiempo que queríamos desarrollar.
I want to show you an app that would help the pregnant women, and we are now testing. Now we are going to launch it soon. It's called MiSIP so far. That may change in the future, and the idea is to download it to use it in the mobile phones. For instance, now that we are testing it, we all have it installed in our mobile phones, but I wanted to show you this so that you could see how it works. So basically, it is installed, and it from Google Play or from Apple Store, and you install it in your mobile, and the first time that you do that, then the screens will explain what the app does. So you can monitor pregnancy, you can connect it to SIPPlus so that the pregnant woman may see her medical record in the mobile phone. We are going to show how. And you have emergency buttons for quick calls. So we are going to see in the main screen and the home page the two emergency numbers that you can access with a single click very easily. Of course, in order to enter the app, you need to put your user's name and your password. Well, if they forget the password, of course, they can retrieve it. And when we log in, you'll see the home page of the app. Here we have two buttons for a quick call. The number that this number can be changed at any time, as well as the name. You have a direct number to call the family or to call the doctor. So just by clicking there, you'll be able to call. And then, as we said, that the idea is to accompany the woman during her pregnancy based on the gestation week. She is going to receive some tips. She's going to be told what's happening with the pregnancy. All the material is being prepared by CLAP to be entered in the app, so that the woman may at all times know what's happening with the baby, what the course is, and some tips and advice for each stage of pregnancy. Then down here we have the app menu, and if we click here on SIPPlus, you will have the connection with SIPPlus. Of course, if you want to see the medical record, you need authentication and security measures, because it's very delicate info. So when the woman chooses to connect, to log in SIPPlus, she will be asked the user's name, password, authentication in the phone. And so she will have to enter a code, because all this is, of course, protected out of confidentiality. Once she's connected, here you authenticate it with a cell phone, and she receives a code. And once you verify it, that, it synchronizes, and then the perinatal medical record. So you have, well, the old perinatal card, that was the card that the pregnant woman carried with her all the time. In this case, she will have it on the cell phone. The perinatal card, of course, you know that the medical record has many sections, and here this is divided into 3 parts. My record, my childbirth, puerperium, post. Here you see the immunization, whether she received the different vaccines or not. See the antenatal visits, each visit, and if we click on each, you see the details of the measures and the course. So obviously, I don't want to bore you because it's all the same system. Then my childbirth, labor, birth, with all the variables. We chose to show it like this, that it's a bit more friendly than the perinatal medical record, because you may imagine that the form, if we put it in a cell phone, was going to be much more difficult to see. However, here you have all the same information and it's available anytime. We also have a part of notes. This is not in SIPPlus, but you can add new notes. For instance, if she wants to write down things that she's going to ask the doctor at the next office, or any tests that she would need, she's going to have it there in the notes bar. And in the adjustments, you can put a name, account, email, changing the password. This is the emergency button, where she chooses the name that will appear on the screen and the telephone number where they have to call. And as I said, this can be changed anytime. And here then, if you wanted to leave the app and log out. Well, we don't have much time, but the idea was to tell you what we are doing. This app, the development was completed. We are in the testing part and entering information so that it may have all the data, so that it can be launched in the near future. And as we always say here, the team of SIP and Clapper, we are always trying to innovate. Luis just mentioned what we are doing with data processing, and this is an app that we wanted to have to accompany the woman during pregnancy. So I'll leave you here, and now the colleagues of the technical part of Clapper are going to present the app, and they're going to tell you the rest. So, thank you, Pablo.
Muchas gracias, Susane.
Thank you, Suzanne.
Dr. Francisco, colegas, y buenos días.
Good morning.
Brevemente y dando seguimiento a
Very briefly,
los colegas, voy a resaltar fundamentalmente dos aspectos.
I'm going to highlight two core issues about SIP that we have developed in this year or in the last 2 years. But before I do that, let me tell you what is happening with the perinatal health in the region, and what do we attempt to do, what do we aim at. You know that neonatal mortality represents, among the 5-year-olds, it's more than half the deaths that happen in children under 5. And this would be due to prematurity, congenital malformations, sepsis, infections, and perinatal asphyxia and trauma. Because almost 1 out of 3 deaths will be related to these prevalence. So there are the mechanisms, and as Dr. Francisco said, a regional plan that is focused to approaching these priorities, and the indicators that are prioritized are geared to reducing perinatal health and to do away with preventable deaths and to reduce inequalities between the countries and within the countries. So it is under this framework that we have strengthened this year and in the previous year 2 key aspects that I'd like to share with you. One, as was already pointed out by the colleague Luis Mainero, essentially the perinatal medical record and the worksheet provide you the tool for recording information, but also to assess the care when you identify risk conditions that are clearly related with the key problems that we have mentioned in the previous slide. So now, in the 2 minutes that we have, let me focus on the two key axes. We have developed new uses for perinatal SIP as a coordinated work at CLAP. One has to do with assessing the quality of care and how we assess the inequalities in perinatal care. And here I'd like to highlight what Luis said about the automatic exits. There are three axes that are highlighted here with regard the newborn's health. One is the perinatal outcomes, and just by clicking on a key, of course, based on the filling of the medical record and loading it into the IT system, you can have national and international information on the pooled information. We know that perinatal deaths are a key thing. As to low birth weight, based on a gestational age, birth at weight, weight at birth based on age at birth, the rest of the characteristics of the newborn, that especially with regard neonatal asphyxia, that is also plays a key role in morbid mortality. And the second component has to do with the quality of care. And we know to what extent the timely clamping of the cord, resuscitation, referral to ICUs, or the different screenings are related with the quality of care and with the objective not just of surviving as proposed by the strategy of the proposal for the health of women and adolescents, but also to improve the quality of care and the quality of health. And that has to do with the conditions with which the newborns are discharged from the ICU or from the hospitals. So the conditions at discharge need to be reviewed, need to be checked by the hospitals, and we need to know the quality of care that they received. And this has to do with supporting breastfeeding at discharge, the implementation of the different screening techniques, Chagas disease, bilirubin, toxoplasmosis, hemoglobin disease, cardiovascular screening, metabolic screening, and the conditions with regard the disease or health of the newborn, immunizations, and the position when sleeping. So you see that you can clearly monitor key indicators and trackers, and you can contribute to analyzing the inequalities, where we have included two stratifiers. One is with just one parent, single parents, mothers that have no partners, and education. So the key indicators that we saw may also be assessed so as to monitor compliance and the reduction of inequalities. And the second component, and this is also related, is that of congenital defects. And finally, we just a week ago, we received the announcement of the creation of a regional perinatal network for the surveillance of adverse outcomes based on this neonatal admission worksheet. This was debated to assess the degree of implementation, and it was updated. So we consider that these two components, surveillance of the quality of care and perinatal outcomes, and the inequalities assessed in a regional network, are going to contribute to better achievements in terms of perinatal outcomes. Thank you, Pablo. Indeed. Bremen. Yes. Thank you, Suzanne. Now I'm going to share my screen in the time that we have to discuss things in just a few seconds. It's a pleasure, my friends, to be with all of you today. I think that you all see my screen, right? Am I right, Suzanne? Yes. So we're going to talk of some innovations that we've had, and as a matter of fact, they have been mentioned, very particularly the creation of a Latin American collaboration basis for SIP, COVID, and maternal death. When we started with the pandemic, we didn't know much about the negative impact of COVID on pregnant women. As a matter of fact, we saw that being young, we hadn't seen such an aggressive behavior as in H1N1 or MERS or SARS-CoV-1. But yet we decided to move forward, complementing the SIP that could be used by SIP users, but also institutions and countries that were not using SIP. That was our big challenge, and hence we developed a clinical worksheet that was meant for COVID-19, but also for other infections that are cataloged as acute respiratory infections of an interest in public health. So this form that we have now prepared for COVID, if in the future we have a pandemic for any other respiratory virus, we would be ready to use it. And that is a great advantage. Here at CLAP, we have a network of sentinel centers where we survey the maternal near miss, and the place where we validate the first drafts was in the hospital Los Minas in the Dominican Republic. Here you are. So we designed these forms. You see them from far, but this is the SIPPlus that is called SIP COVID respiratory infections. And we promoted them at PAHO with colleagues from all the countries and in some other spaces who also received us so that we could share this. Now, just as the infection entered the region, we started to notice a behavior that had not been reported in other regions. You may remember that in late 2019, it started in China, and the first papers were published early in 2020. And in China, they hadn't mentioned any maternal deaths, and even in Europe, the pandemic had not reported too many maternal deaths, one in France, one in Spain. However, very quickly, the pandemic entered the region, and in March, and by March 13, the first maternal death had been reported in Brazil, and then 5 days later, one in Mexico. In the month, in just a few days, we had 5 and 6 in those countries respectively, and then we have 20 and 29. And in the following months, other maternal deaths were seen in other countries. As a matter of fact, we warned WHO on June 11, 2020, with 6 countries in Latin America that had already reported 100 cases. And there we didn't include the US because it was only for Spanish and Portuguese speaking countries. So we added an addendum to the SIP COVID worksheet that we had developed, and so we incorporated, and this is something that Luis mentioned a few seconds ago, the parts 1 and 2 of the death certificates to properly characterize the cases of maternal death and COVID. So that addendum was very important for us. So in that period, we wrote a protocol to create that Latin American collaborative base, and with this, the protocol was approved by the Ethics Committee, the Bajo ERC, and right away we invited all the countries that had COVID-related maternal deaths to be part of this database. Unfortunately, I won't be able to share with you the results that we've had because right now they are about to be published. But let me share the following. This is updated up to November the 30th this year. There are 24 countries in the Americas that reported 3,200 maternal deaths. 4 of those countries are not Latin, Suriname, Belize, Bahamas, I think, and the US. So we subtract 229 deaths. So we had 20 Latin countries with 3,008 maternal deaths. Well, actually, 11 countries did not participate in the database, so we had to remove 2,292, and we had 8 Latin countries that had 716 deaths. Some of those countries could recover 100% of maternal deaths on COVID, while others did not have such an important uptake. Now, the study that we are presenting to Regional Lancet for America, where all the members of this Latin American base act as authors, you see that we recovered 447 deaths out of the 716, and that is a very significant number. So this shows that it's feasible to work in collaboration. You may have heard that I said, well, actually, it's 12, but it's 11. Well, because there's an additional country that we have, but we didn't incorporate it here because it turned out to be quite striking. The country formally reported a limited number of maternal deaths. However, the colleagues that have reported, and people from the ministries themselves, found 5 times as many deaths related to COVID than officially mentioned by the government. We tried to make to convince the government that we had to make that information transparent, but we didn't manage to do that. So we couldn't convince them. So 2,292 maternal deaths were left out. So not only did we find a huge number of relevant data, many of which are known, but others are not, so will they coincide, but also the relevance of transparency of data, you know, particularly that maternal death continues to be an indicator, and not only is it a health indicator that speaks of the quality of services, but sometimes it also for governments, and this collaborative work enabled us to see that, and hopefully in the future we'll have a much larger number of countries sharing information. Thank you. Thank you, Bremen. So now we'll give the floor to Rodolfo, the last presentation, and then we'll close. Rodolfo, please. Perfect. Thank you. And welcome everyone to this session. I'm the last. So I want to thank the 290 participants, but I'm going to open the oven and show you what we are cooking. I'm going to show you absolutely a scoop of the systems, the medical records of sexual and reproductive health, and as was so well put by Adish, it's one of the incorporations to the SIP. Notice that I'm opening the medical record of gender violence and sexual violence. It's in English because it was designed to give response to a request of technical cooperation by Trinidad and Tobago. And you can see how live I'm sharing from the development system the data that will be incorporated here. We have a total of 9 screens that are going to be part of the medical record. This medical record registers the name of the woman, the ID, the union status, ethnicity, religion, among other things. So, and the education level. We also have the transient, we keep a record of the initial health care, the name of the healthcare professional that is providing care. And here we include a variable that is sensitive to gender identity, because we have gender identity and sex. So this clinic medical record could be used for cis or trans women. Then we have the characteristic of the personal history or personal record, whether there were any previous pregnancies, the lab test, but also some questions that the healthcare professionals should know how to ask at the time of the consultation, so as to show the sensitivity of the data and respecting privacy, and that the data will be shared with other systems. And it's possible to share data with other systems only if the woman has personally approved for this to happen. Then there's a description of the incident. We show what happened, what occurred, and then after the clinical examination, then the woman is requested to the informed consent. She must sign in writing for the physical examination to be done, and the physical examination following the standards of the recommendations for gender violence. We took the characteristics that are going to be part of this segment. The medical record also turns into a track of care where following each filling each item step by step. This shows what are the elements that are essential and of these women that are survivors of gender-based violence to one episode or more. So here you have sexual assault, a violation, or beating or violence. Then the emotional state of the survival of the survivor, the lab test, pregnancy, blood type, genital swabs, etc. And we very quickly identify any life-threatening issues, even including suicidal ideas. And then the legal evidence that is collected and the immediate care divided into the crucial elements, such as prevention of STIs, the prevention of HIV, with the immediate delivery of medication, and then if needed to accompany the women in other lines of work, and then whether she authorizes or not to have a police report and whether it took place. And then here you have a certain number of lines that where you can add the number of people depending on the woman, and finally the referral. With this, we already have a methodology, accompaniment, protection, and assistance of the women that have suffered and survived on this. So I opened the oven and I showed what we're doing. And now let me show you another new thing that was also mentioned by Luis, and almost nobody knows it. So it's absolutely a scoop. It's the contraception medical record within SIP, and here I filled this. This is a fictitious patient, Anne Boleyn. She is 20 years old, and she lives in a street, the best of the world, in a place called Nongahamas. So here, this woman can be contacted through any of these pathways, and as was very well pointed out by Marcelo Rubino, you can create a contact between MISIP and the medical record if the woman authorizes us to do that. We also have the ethnicity, the civil status, and here we have this identity, gender identity, sex and gender identity. We know that that women may well, you know that you can have cis and trans, and this here you have the intervals or the post, whether there were any contraception measures. So you'll be able to see a woman that filled in the data. I won't discuss each in detail, but I want you to see these cancer, immune diseases, etc. So here you have the medical criteria for eligibility for contraception of the WHO.
You're familiar with this that has been carried to the clinical record, and these variables chosen here lead us to knowing that the woman doesn't smoke, our patient Anne Boleyn doesn't smoke, and doesn't have any risk condition. Therefore, when filling this form, we'll realize that all the contraceptives are in categories 1 or 2, meaning they have been recommended. We don't have any danger. They can all be used. But let us assume that our patient Anne Boleyn begins to smoke and smokes 30 cigarettes per day. Does this modify the medical criteria? Oral contraceptives become number 4. It is no longer recommended. And progestins are in category 3. This is just an example. For example, if I would anyhow, well, I didn't understand. It's in category 4, and I want to do combined contraception. There's a warning. Beware, this patient isn't eligible. Therefore, she will give us this warning. When preparing the contraception, it will be adjusted to the reality of each woman, giving access to the best quality of care. Thank you. I close and hand the floor again to Dr. Cerusia. Thank you. Thank you, Rodolfo. Well, the first thing I want to tell all the speakers who participate is to open their videos. At the end of our meeting, we're going to see a video of SIP prepared by CLAP. And I have a very special request for all of you listening. We've had like 300 people listening. The volume of information we have is difficult for everybody in CLAP. They each had 5-10 minutes, and we could spend a lifetime, but I'm sure that there are other countries that would have liked to have made their own presentations, and we had the difficult task to choose 3. So I thank them all. And I have a very special request for all the people listening. This video is in YouTube. You may put a thumbs up. And in this way, artificial intelligence will recognize it as an important video. And please share it also. There are friends that are busy right now. They were doing other tasks, different colleagues. Please share it with them. It's very important that people become familiar with this true set of tools we've seen in the main areas that CLAP works with: maternal health, reproductive health, perinatal health, neonatal health, and the information system. I must thank you who stayed, but also those who've prepared the meeting, the lecturers, and allow me, from the SIP team that's responsible for creating and design this meeting. There's somebody I can't see in the videos. I don't know if Luis is with Pato, but I wanted to thank Pato, Jose Luis Diaz, who's there. Yes, he's there. He's been our collaborator for the longest period. Pato always says that he was born in CLAP. It isn't true, but nearly so. He is a collaborator in CLAP and has been working for long years. He left, he returned, so we didn't want him to be at home. So thank you so much, Jose Luis Diaz, and also Luis and Marcelo, who've been with us so many years. I also wish to thank Anna, who is always coordinating all the work together with the interpreters, Trini and Inés, and Priscilla Juan, responsible for streaming, and all the CLAP team that made presentations, Pablo Duran, Remy de Mucio, Rodolfo, ultimately all of you. To end, we shouldn't forget Gerardo, because he's been somebody who had worked during many years together with us. And there, Anna just placed this picture. This picture was taken in Trinidad Tobago, and you see his happy face and how happy we were all. I think it's difficult to thank somebody who isn't here with us physically, but Gerardo will remain in CLAP. So for everybody, all the best. Thank you for being with us and participated in this meeting. Please share it and spread it, and stay on to see this SIP video that will also be available for you to share it to other colleagues. We received many messages and compliments, and we'll answer them all. Thank you so much.
Bye-bye.
The video goes now.
El sistema informático SIP es un producto gratuito de OPS que registra la atención perinatal desde la primera visita
de la madre con el recién nacido. Whole life cycle, contributing to the timely decision making. The clinical record is entered in the computer or other mobile device and is conveyed online or in a delayed way with maximal security and privacy guarantees. SIPPlus may have a cross-conversation with other records. It prepares automatic records, indicators of the care population, identifying inequality gaps, guiding departments. The more available the information, better healthcare. SIPPlus helps 22 countries to meet their commitments in the health of mothers and newborns. SIPPlus is the solution in perinatal records, and the best is about to come.
PAHO's Perinatal Information System, or SIP, is an electronic health information system that allows healthcare providers to deliver better care for mothers and their unborn babies through the creation of perinatal clinical records. The mother's information is entered into the clinical record throughout her pregnancy, starting with her very first visit to the antenatal clinic until the birth, when she and her baby are discharged from the healthcare facility. The perinatal clinical record is secure and is easily available in hard copy or via electronic devices. SIP also allows healthcare workers to collect data on important health and social indicators. The system also generates reports that are easily analyzed to identify gaps and trends. Additionally, SIP can be linked to any other electronic database existing in a health facility or institution with the country. SIP is available for free to all PAHO member countries. 22 countries are already using SIP to help fulfill their commitments to the health of mothers and newborns. The better and more accessible the information, the better healthcare will be. SIP is a solution to generate and access comprehensive perinatal clinical records.